tell me this. I mean, your story seems to be very different from Larry's story. When he was told he had cancer, he was kind of not devastated, but just kind of, is my life going to end? You think about a morbidity, and we kind of talked about it. When you heard of your diagnosis, what's the first thing that came to your mind?
Relief.
Relief.
Most people would say a cancer diagnosis is a horrible thing, and yes, it is a horrible thing, but to me, it was a blessing because, first of all, I had what was causing the problem, and that I knew that I could be treated and be able to control it. But the other thing is that I've gotten to meet and work with the most amazing doctors, the most amazing people. With my organization, we have literally helped tens of thousands of people through the years, through their journey. And so to me, it was really a blessing.
That's amazing. So it's kind of, we had interviewed somebody for another show, and they'd said it's ironic. It's like an ironic blessing. What happened? Would you? I mean, it's completely changed where your life was headed, probably.
It absolutely was. I was a homemaker. I had 2 beautiful children, young children, and this was the furthest thing from my mind, that I would be a patient advocate and traveling all over the country and help advocate for patients. I never in a million years dreamed of this. But because of my diagnosis, I have helped so many people, and I have helped my family. My daughter was diagnosed at 22 years old.
At 22. Tell us a little bit about that.
She was diagnosed. She was showing symptoms, and I pushed and pushed and pushed. And finally, the doctor said, okay, we'll do some blood work. And they said nothing too much to worry about. And before she left for school, I said she needs to have something done. And they found the tumor in her stomach. And, she was very, very lucky. They said that chances are they probably discovered it 15 years or 20 years before
it would
anybody else.
Anybody else?
It.
So is it common, Dr. Morse, for it to run in the family? Like we know in breast cancer, you have these genes, BRCA1, BRCA2. Is it common for neuroendocrine tumors to run in the family? And that's a broad statement, neuroendocrine tumors, but.
Yeah, it of course is known by doctors that there are certain syndromes, the multiple endocrine neoplasia syndromes, but those are really rare. Originally, it was thought that it was sporadic. It wasn't really a hereditary cause, but now there's families that have been identified where multiple members do. And in fact, the more you ask these questions, it's really important to take a family history when people come to see an oncologist, because if you take a broad enough family history, you start finding there actually are up to 20-25% of families where somebody else has a neuroendocrine tumor. And there is some research suggesting there are certain genes that may, in fact, be the cause of those hereditary syndromes that haven't been characterized so far. As is the case with anybody that comes to see us, when we take a family history, if we sense that there is one, we'll certainly ask people if they want to have specific testing done. At our institution, of course, we have hereditary cancer counselors who can
genetic counselors?
Genetic counselors that can take people through that process. Many people choose not to do that because of concerns over insurance and so on. I think that was something you had brought up.
Right, yeah. That was one of our concerns is, at 22 years old, do you really want to label
somebody with a kind of chronic disease in a way?
Right.
Yes.
Right, and so we chose not to do any testing at this point. But, she goes in and she has her routine test, and, because we found it so early, the chances of it ever metastasizing anywhere else is very slim, and we'll just stay on top of it. So to me, like I said, this disease was a blessing in a way, and maybe the reason I got diagnosed and became an advocate is to save my child's life or to save another person's life. What we do at the Neuroendocrine Cancer Awareness Network isn't only about me or my family. It's about the patients out there, and we have to think about the next generation and get more research out there and get more drugs out there to help us. It's not about what's going to happen now. It's about what's going to happen in the future.